Tell us about your first visit to the practice first, because you saw Philippa first, didn't you?
Yeah, so I saw Philippa first. I just moved to Cornwall at the time. I was looking for... My teeth weren't in great condition because I'd had braces when I was younger, and then I'd stopped wearing my retainer.
Yeah.
My gaps had started opening back up again. I was just becoming very, very aware, very conscious of how I was changing, I guess. So I just moved to Cornwall at the time, and I was just... looking for somewhere to begin fixing that problem, I guess. And this was the first, I didn't know much about dentists in the area. I was just doing my own due diligence, my own research. Stumbled upon this place online, and obviously the feedback, the reputation just slaps you in the face straight away. It's all there in broad daylight. So I was like, right, okay, I'm gonna ring this place. Got a consultation. Philippa was the first person I had contact with, apart from obviously the receptionist at the time on the phone. And Philippa's just got this uplifting kind of air about her.
She's quite absorbing, isn't she?
Yeah,
she really
she's just really bubbly and just really polite, really nice and welcoming. And I was just like, oh my God, I feel like the only person in this dentist, without being too cliche, without sounding too kind of much, but a lot of the time you just feel like, I guess you're just in a queue of people and you're just a number and you're just getting...
on that conveyor belt.
Yeah, exactly. But I just never ever got that here. I really felt like Philippa was like looking after me and kind of listening to my problems and
before you came in for the visit, in being sat in the waiting room, it's quite relaxing, isn't it?
It is, yeah.
So
Completely.
You can relax a little bit before the visit.
Massively, yeah. You kind of feel like you're sat in your lounge and you're just ready to kind of, just switch off and not that you're about to go upstairs and
just relax for a bit. And
exactly, which is a huge part of the process, I think. If you, if you're feeling relaxed, it changes everything. That's exactly what you want.
Because your case was quite complex, wasn't it? You had some missing teeth you were born with some missing teeth, adult teeth.
Yeah.
And you had some baby some deciduous teeth as well that were still there.
Yeah.
You had some of the teeth were odd shapes and different sizes as well.
Exactly. I had a bridge, I think.
Oh yes.
I had an implant, and they were both
with metal backings as well.
Exactly. Yeah. My teeth were kind of becoming out of shape, so they were looking out of place. And every time I looked in the mirror, I could almost tell that I had a false tooth.
Yeah.
It's like,
what was the metal on the back as well?
That really didn't help. That was discolouring,
one
of my front teeth. So every time someone took a photo, I'd always, I could tell from my smile that it wasn't right, and I really thought other people might start clicking onto that.
It's interesting because just before off camera we were talking about how you felt about the teeth before, and we were talking that a lot of people hide their smile or don't feel confidence in smiling.
Absolutely.
And from a young age you've had that pretty much your entire life.
Exactly, yeah. Even after I finished my whole treatment with braces, which was ongoing for years, all through school, I still felt like the bridge and the implant I had just looked false almost.
Yeah.
It looked artificial. My smile never looked natural, I guess, and that always came through in photos. And then the more that progresses, the more you kind of learn to hide your smile, how you react in photos and stuff like that. And in conversations, a conversation like this, I'd be talking closed mouthed, or I'd be putting my hand up, and there's all kinds of things you do to kind of shadow what's going on in here. So huge, like a major kind of change in life. It really does just
change your life,
distort how you feel when you can't smile properly.
And how was the consultation process? Because after you saw Philippa, things were quite complex, and Philippa said, okay, well, I think you need to go over and see Andrew, he's going to have some solutions which can help you. And you came to see myself, we had a free consult, and we talked through
I never felt like there was ever a problem there. It was just like a process which I kind of slotted into straight away. I never felt like I was faced with anything too detrimental or too kind of, big. It was always step by step by step. small process at a time. There was never a huge decision to make. I mean, it's a big decision to make in the beginning, isn't it?
Yeah,
because you know it's going to be ongoing for years. There's a huge cost implication, and you know you're going to be after attending a dentist every week or every month or whatever. But I guess I'd already made that decision in the beginning, and
because you had quite a lot of treatment through the process. We actually almost did the full spectrum from some
and the root canal as well. That was a big part.
Course.
So there's on the bottom front tooth here. There was some root canal stuff I had to get done in the beginning.
So there was the root canal. You then had Invisalign as well.
Yeah.
And how was the Invisalign process? How did you find that? Wearing aligners and discomfort level and
a lot better than I thought it was going to be.
People's perception is that it's going to be very sore, very painful.
Absolutely, and especially with
disrupt their lives
massively. And it's just not what you think it is. I mean, I remember back to the days of having braces, and you know they're a bit of a nightmare. They you know you've got big bits of metal and train tracks in your mouth, and you know it stops you eating properly, it stops you talking properly. It's quite sore and uncomfortable. Never really had that with the Invisalign.
No.
I mean they tighten up obviously and they're a little bit sore, but no one ever said to me, have you got something in your mouth? And one of my friends is now having it done as well, and I didn't even notice he had it in at the time. It was just completely invisible, you know, like it's supposed to be. It was just such an easy process. I was pleasantly shocked by how simple and straightforward it was.
It's nice to know it's that one fee, that package that we have.
Yeah.
And then you get all the straightening done, all the whitening. And the whitening process was simple as well for you.
Yeah, that was a really enjoyable part actually.
It's amazing the difference that made as well, because you had different coloured teeth, and from a cosmetic improvement, one short course of whitening treatments, and everything was looking very nice and white.
Within a week, people were saying to me, "Have you what's changed? You know, have you done something? Your teeth are whiter. That's what it is." People I see every day, you know, they began to notice.
They're probably noticing your increased confidence and happiness with yourself as well.
I think happiness and well-being first and foremost. It's, you know, just absolutely, it's fundamental. It's I mean, it's something which is just bleeding into every single day of my life now. You know, I wake up and from the moment I get up, I can smile, I can talk, I can be confident, and I've just never had that.
It means that you haven't got the worry of teeth in your life anymore.
Absolutely, but the worry of teeth it's such a big umbrella. It can cast a huge shadow on your life if it's a problem. But then when you rectify that problem, it just alleviates so much.
And I was saying this to you earlier, that actually it's one of the best parts of my job, is that actually being able to see people like yourself who and then afterwards seeing the confidence it boosts them after, and them smiling again.
It must be massively rewarding. Because you know I'm one in 100 or 1,000 people, however many you've seen, but it's just completely flipped my life around.
The next, after we did the straightening and the whitening, the next treatment we went into, I think we did some composite bonding for you as well, didn't we? We did some cosmetics changes, because as we mentioned, you've got some small teeth, and that involves adding some tooth-coloured filling to the teeth to change the shape and improve the cosmetics. And that, because at each stage you had quite a big change, and that was another massive improvement, wasn't it? When we did that.
It's an exciting process, because you're getting closer and closer to your goal each time you come. So it almost makes you excited to go to the dentist, because you know that each time is going to be more improvement. You know, you forget completely about any pain or discomfort you might be going through, and you just think, my smile's going to improve every time I turn up. So I'm
going in today, I'm going to get this.
Absolutely. I was excited to get to that. I was buzzing to get. I was like, when's my next appointment scheduled for? You know,
I remember you saying that at the time.
All my plans revolved around just being able to make the appointments and coming to the dentist, which, you know, in turn it does kind of shape your life a little bit, but it's for the greater good, right? It's for a better cause. So it's I found the whole experience quite pleasant, if I'm honest.
And after we'd done the bonding, we then moved into the implant treatment.
Yeah.
And probably, I bet you were daunted and worried about having an implant placed, a new treatment.
Yeah.
So what were your fears beforehand, or worries about having implant?
My fears beforehand with that was that I was going to be missing a tooth for a little bit, or there was going to be some kind of impact on my smile which other people might notice, like a missing tooth or something different to the norm.
Because you're public facing as well, aren't you?
Yeah,
you're working in the restaurant industry. You were working with people all the time, so it's a massive part.
Yeah, so I lead a team of chefs in a kitchen, but not only that, we are on show to the public as well.
Totally.
So exactly, so often the public will come up and speak to us, and conversing with people is a massive part of my job, my role. So to think that I was maybe not going to have a tooth at some point. Because I thought that, so you put like a root in, don't you? And I thought while that was healing,
the implant replacement root.
Yeah, exactly. So while that was healing, I was going to be without a tooth, but that was just never the case. I mean, you put a temporary fitted tooth on there, which looks exactly as it does now. So there was no.
And sorry to stop you, but it's interesting. The one thing you haven't mentioned is the actual placement visit of the implant itself. And I think that's quite telling, because a lot of people worry about the implant placement itself and
doesn't
the pain.
Come into it. Honestly, the pain, it doesn't feature in your worries, because you know that you're getting something far better out of it.
But you didn't get a lot of pain after anyway, did you?
No, not
paracetamol, ibuprofen for it?
Paracetamol, ibuprofen, a little bit. I think I took it for the first 24 hours.
Yeah.
And then I stopped. And just let it heal naturally and do its thing, and it was completely fine. I mean, the pain went away very quickly.
Had root canal treatment and crown preparations.
Yeah.
How does it compare to that? Having an implant placed, simpler, more
simpler, definitely.
Yeah. Okay.
Yeah.
The simpler,
the root canal stuff was a bit of a nightmare. The first time I had it done was through the NHS, and the whole procedure itself took 3 to 4 hours.
Gosh.
And the recovery process was probably
more
2 weeks.
Yeah.
And this, I just felt like it came and went in a matter of days. So really quick turnover, which was great.
and the next thing I want to take you back to actually is the day we finished the treatment. Because for me it's all about the process and making sure you're 100% happy with it and getting it as perfect as we can possibly get, and you're leaving with the end result. And you were quite emotional on that day, because I know it'd been a lifetime journey getting to this point. And when you first saw the teeth,
it completely trumps all expectation. I guess you have this idea of what you're potentially going to look like at the end of it, but you cannot foresee how that is actually going to look. In reality, it was just so much better than I thought it was going to be. When you kind of look at yourself in a face you see every day, all the time, and then you've got this big beautiful smile. I honestly can't put it into words. I remembered standing over there looking in that mirror for the first time, just looking at my perfect sets of teeth, and just being like, it was
been
incredible.
Great seeing you go through the journey and the change to you and the confidence it's given you, and now teeth are not something that's limiting you.
And it is a massive factor, I think, in your life, which does that. Just your teeth. I mean,
whether it's a cosmetic thing or a functional thing, if you're struggling to eat things, cosmetics is a massive part of how you feel about your smile and smiling in front of the camera or in photos, or
absolutely.
How you're
and functionally, throughout the days as well. I mean, there were times when I'd had treatment in the past where I'd had cosmetic work done, and eating became a bit of a problem, because I had a bridge on at one point and it kept coming off when I was eating, and that was something I was really worried about. Kind of ultimately with this whole process is, what am I not going to be able to do now that I've got really wonderful set of teeth, and there's been a fair bit of cosmetic work done, there's been bits added here and there, so they're not my own teeth. But you know, how is that gonna affect, you know, eating, drinking, whatever? And that was a major worry at the time, but it's just not caused me any problems. Nothing's come out. My teeth are all still solid.
It's been quite a bit of time since we've completed it. I forget how long. Probably it was last summer, I think, wasn't it? So probably August time.
Yeah.
So you're early on in your journey, but one of the things we focus on is doing the minimum we need to do to achieve the best result for you and the longest outcome.
Yeah, of course.
So I mean, you've got, you know, you're not going to need to worry about having, you know, problems or bridges falling off.
Yeah, I mean, it's just a nightmare when you have got that worry and you're eating and you're in public, or, you know, even on your own. And you know, you use your teeth in so many different ways. You know? Eating, speaking, confidence. They really do play into your daily life in so many ways. Yeah. So if they're not good, it really affects that in a negative way. But if they are good, you know, huge positive effects, like night and day difference. It's just an incredible
teeth shouldn't be something you worry about.
No, exactly. But they are, and they have been to me for as long as I can remember, going back to, you know, when I was probably 4, 5, 6, very young. And now, all of a sudden, all of that worry's gone away. So.
And it's been, you know, this journey has not been just the treatment time. We were talking earlier about after the Invisalign treatment, we've given you retainers to wear, and that the only way to keep your teeth straight is if you're wearing retainers every night. And we gave you fixed retainers as well. Yeah. We've also put you on a sort of a scheme, a process for looking after your teeth long term. So it's completely changed the way you look after your teeth and
absolutely.
smile.
It's become a huge part of my daily routine. You know, twice a day. You kind of given me a protocol when I left, you know, a kind of thing to look after my teeth, and I've stuck by that so strictly every day now. I just don't think people are aware of, you know,
the level it needs to be.
Exactly, and you're not. That's not ingrained into you from a young age, or it's, you know, your parents kind of force feed you dentist appointments, make you go, and it's this very kind of unwanted and like mundane thing that you have to do, and I guess you don't want to keep up with it. But then when your healthy, beautiful smile is restored, you all of a sudden you want to nurture it. You want to look after it. You know, it's almost like you've got like a pet or a nice car or a kid or something that you just want to take care of, and it becomes another complete, like, less of a chore. It doesn't come into it anymore. It's just something you do on a daily basis without even thinking about it now.
And this is something I see time and time again, actually, where one of my ethoses for the practice is not just about a patient coming in, having their treatment. Okay, bye Matthew, we don't need to see you again. It's actually, you know, if you want to, you can have your lifetime here, and actually we can nurture you through that process, look after your teeth, give you all the skills that you need to look after them longer term.
Yeah, exactly.
Obviously do it in the best quality dentistry to make sure it lasts the most amount of time. And I've seen it time and time again. I'd fix and repair them, make them look beautiful, and get them how you want them. But then actually,
down to us, right?
It's in your hands then, the long term of them. And when you've got that level of care, you're going to get, you know, you've got it for the best. You can get the best out of it.
Exactly. I think it's a massive part of the restoration process. You know, is you teaching me what I can do to look after, you know, my own teeth. Because at the end of the day, they're mine. And it's, you know, it's part of my body, and I don't want to be hassling you every week. And you know, it's like you're taking the stabilizers off, and it's like, there you go, run with it.
I actually love that analogy of the nurturing, because that's exactly what it's about. Dentistry is a lifetime process, and it is, we go through this process and journey and nurture you through that, and it's a long-term process to look after.
It should be an education to everybody, but people are just not educated in that way. Well, thankfully to you guys, you seem to be doing that. So
we're trying our very best to give people the skills to look after them, so that actually I can look at then new people to get them to the same level.
Yeah.
But I don't need to worry about you. You're looking at
Yeah.
them.
Well, I'll come back maybe once or twice a year and just make sure everything's
It's
going
perfect.
okay. But it's in my hands now, and it's just become something that I love and want to nurture on a daily basis. So hopefully, if I keep doing that, things will be good, and I'll stay out of your
Great.
way.
Well, thank you very much for coming in, especially using your Saturday and spending the time to talk to me.
Anytime.
And
Like I said earlier, when the
Absolutely.
opportunity arose itself, I was straight there. It's been a massive, I'll say it again, but a massively life-changing
yeah,
transition, to me. So to do this small favour in return really is just a drop in the ocean from how much you changed my life. So
great.
thank you. In return.
Thank you very much.
Nice one. Cheers.
Thanks. It's been a pleasure.